My mother lives here alone. On the day that she had her fall, she managed to phone me. I wasn't in the area, I was at work, couldn't come to her, so I phoned the GP service and they said that they understood my concerns, that they would then refer on to the urgent care team.
This is the future of how we see the delivery of healthcare in many ways. Urgent community response is nurses, physiotherapists, occupational therapists, visiting people at home and deciding with the support of the hospital whether or not patients need to come to hospital or preferably be treated in their own home.
We will undertake an assessment in the patient's home with the intention of providing interventions to enable them to receive their treatment in a familiar environment.
That team would be able to come out to the house, would check over my mother, make sure that there weren't any physical injuries or anything that they were concerned about that might occur later on because of the initial injury.
We know that roughly on average 95% of the workload we go to fall into this urgent care bracket and are not the life and death emergencies.
The ambulance crew will respond as normal. They do their high-level assessment, then call the urgent community response implementer, and they will share information. If I'm needed, then they will call the hospital and speak to someone like me.
It really benefits our staff by being able to have clinical discussions. We really try in SCAS to avoid our clinicians making sometimes really difficult decisions in isolation. So it gives them that backup and that support of having that advice at hand. We can get our crews back out on the road quicker to attend to patients who are waiting for an ambulance.
So the comprehensive assessment will examine your social, your physical, your environmental and your psychological well-being. And in addition to that, we will ask you about what your wishes are, what your treatment escalation plans would like to be. Because we are now able to undertake diagnostic tests within somebody's home environment, it's negated the need to transfer to hospital. For patients, once they realise and understand that we've checked their bloods, we've had a listen to their chest and their heart, patients and their families are often more than delighted and actually quite relieved to stay at home.
So the biggest thing that I hear and see is that someone who in previous circumstances would have to come to hospital no longer has to and still gets better. And the biggest thing about that is we often find people are getting better quicker because they're in their own familiar environment. It's often the case that we can get treatment to someone to make them better sooner than if they were brought to the hospital and had to queue for a long time in the emergency department or other front door service.
From the urgency at the beginning of this journey with my mother and the care that she needs, it is now obvious what's happening next and how everything links into the next stage and the next stage, so that I am perfectly happy that she is now looked after properly, and not just for that immediate few days where the urgent care team were around, but for the ongoing future.
We want the supporting network, family members, relatives, loved ones to continue to be involved. Above all, we want them to know that we will ask, would you like to come to hospital? Would you prefer to stay at home? Can we treat you at home? We will ask that every time. That's the big change in how we're doing healthcare.
I'd much rather my mother stayed at home where she was comfortable, where she was happy, where she felt safe. Had there been any serious injury, obviously we'd have gone to hospital.
We've moved away from that historic belief that all patients must go to hospital. We will look at other options, we will look at the most appropriate options and have those clinical discussions to make sure that patients are safe and they do get that hospital level care at home or as close to home as possible.
It brings the best of the hospital into people's own home to make them better quicker in their own environment, which we can't replicate in hospital. It preserves the use of the hospital for those emergencies and conditions which can only get better in hospital.
Just believe that the team there are there for the best reasons and to give the best care for your loved one. Be confident in the response that you're going to get, the people that turn up are professional and sympathetic, and it's been fabulous.